What about medication? Well, we don't know. We know the stimulants aren't particularly wonderful for them. They don't hurt them, but they don't help them all that much. What else might work? Well, I don't know, honestly, but let me conjecture. If I were writing a grant tomorrow, I might speculate that Strattera might work for these children, only because these are more anxious children, and Strattera treats anxiety when it coexists with ADHD. So maybe atomoxetine might have a shot at this disorder. We don't know. Nobody's done it. Another drug that might be interesting is Provigil, modafinil. Modafinil is an anti-narcoleptic, and it does seem to help people with ADHD. It might help this group even more, because you remember those symptoms I showed you 2 slides ago? Does that sound a little narcoleptic to you? Lethargic, slow-moving, drowsy, staring, inattentive. Maybe a brainstem drug might help you. Again, all speculative. We don't know. By the way, that is all we do know on SCT, so please don't ask me any more questions about it, because you now know everything I know. Right? What I do want you to know as a family is to understand that that's not ADHD. ADHD is quite different from that. And so if you happen to have an SCT child, or you know someone who does, please don't tell them to read the books on ADHD. They will be sadly misinformed. They will be told of all kinds of risks and all kinds of treatments, which, as far as we know, have little, if any, application to these children. There is no book for parents on SCT, not yet, nor should there be. We don't know enough. But researchers are now studying these children. The very first psychological treatments for SCT were published about a year ago at the University of California, San Francisco. And so we're now beginning to see more and more research on SCT children as distinct from ADHD children. But what I would want a family of an SCT child to understand is that this is an ADHD. So what you should be worried about are not the things families of ADHD children should be worried about. It's pretty much going to be a school-based issue. And the treatments that don't work for those kids might well work for your child. And the treatments that do work for those kids, such as medication, might not be so great for your child. No harm, but not necessarily so great.